Riddhi, you can start. I already make you a co-host.
All right, thank you. जय जिनेंद्र वंदना मी नमस्मी समनी जी. All right, so I'm going to share my screen. So yesterday we talked about the diagnosis of diabetes and some complications, and today we're going to talk about conventional treatment of diabetes. Okay, so we're going to focus more on treatments for type 2 diabetes, but just as kind of a reminder, type 1 diabetes is different. It's autoimmune, and there's an issue with lack of insulin because the cells that make insulin in the pancreas get destroyed. And so the solution for type 1 diabetes is pretty straightforward. The main treatment, really the only medical treatment for diabetes type 1 is insulin, and that's either via an injection or a continuous pump. There are some other more complicated strategies like a pancreas transplant. That is a higher risk, but you know, the benefit of pancreas transplant is that you may be able to get off of insulin, off of the insulin medication, but you do need to take lifelong medications to suppress your immune system from rejecting the transplant. So it doesn't always work and it does have a higher risk as well. And it still involves taking medications for the rest of your life. And there's something else called islet cell transplant that's a little more complicated and a little more, it's still being researched. So it involves transplanting not the whole pancreas, but some of the cells in the pancreas that make insulin. So we're going to focus, like I said, more on type 2 diabetes and the management. In type 2 diabetes, the main issue is that your body becomes resistant to the insulin that's there. And over time, you can have decreased insulin production as well because the pancreas is working extra hard to meet your body's insulin needs. And that can, over time, cause decreased production of insulin by the pancreas. So there are many different treatment approaches to type 2 diabetes. The ones that I want to focus on are a couple of different categories. So lifestyle and diet modifications are huge in type 2 diabetes. There's exercise, which kind of goes into lifestyle. And then, of course, lots of different medications as well to treat type 2 diabetes. In terms of lifestyle modifications, kind of just simply put, biggest things that I thought of would be just stress management. So anything that you can do to decrease your stress level, whether that's meditation, deep breathing, yoga, reading, um, whatever stress relief. People have lots of different ways to manage stress, even therapy. And then just good sleep patterns and getting adequate sleep also has been shown to help with blood sugar control. This is a diagram that kind of just goes over the impact that stress and depression can have on someone. So it affects, stress can affect your body in many ways, but that increased stress response makes your cortisol levels go higher, and that can increase your body's release of blood sugar and also increase your body's insulin resistance over time. Um, and then just in general, I mean, I know when I'm stressed, I don't eat as healthy. So that, the dietary implications of being stressed as well play a role in diabetes and insulin resistance. There are a lot of diet modifications that help in type 2 diabetes and make it, sometimes reversible or at least more manageable. And diet modifications may help someone get off of medications entirely or at least decrease the dose of medications or the amount of medications they need to manage the diabetes. So, a big component of a healthy diet is also eating at regular meal times, kind of based on how your body naturally releases insulin. So, healthy meal times are very important, not eating too late, not eating in the middle of the night, kind of thing. Um, and then the healthy, eating healthy in terms of eating more complex carbohydrates, more fiber instead of the simple carbohydrates, and on the next slide, I'll have that slide that I had yesterday that kind of goes over what's a simple carbohydrate versus a complex carbohydrate. But um, when you eat, the sugars that you eat and the starches are broken down into the glucose, the blood sugar, and the healthier carbohydrates would be your fruits, your vegetables, your whole grains, your legumes, some low-fat dairy products, so milk and cheese. And then a fiber-rich diet also helps because it helps slow down the absorption of that blood sugar, how quickly your body digests the food. So foods that are high in fiber include fruits, vegetables, especially the skin of the fruit versus just having like peeling it or having fruit juice. So the skin of the fruit is the highest source of fiber in the fruit, and then nuts and legumes as well. You see, and then whole grains too. These are just some simple, there's so many other dietary modifications, but kind of just focusing on more healthier, more complex carbs, fiber-rich foods, lots of fruits and vegetables. That goes a long way. Now, fruits are also high in sugar, but it kind of, what I recommend to my patients is kind of everything is okay in moderation. So having fruit versus having soda, fruit is much healthier. So some people will tell me, oh, someone said, I should never eat grapes because I'm a diabetic. That's not accurate. You can have it in moderation, and it's all about, controlling. You may not you shouldn't have a whole bag of grapes maybe, but combining that fruit with a vegetable and with fiber and having a well-balanced diet, that's more important than saying, oh, I shouldn't have this at all. So this we talked about yesterday, but simple versus complex carbohydrates. So the simple carbohydrates are the ones that are broken down fast and they release blood sugar into the bloodstream fast. So that would be your candy, your ice cream, your sodas, cookies, white bread, white sugar, versus complex carbohydrates. The breaking down and the increased blood sugar is slowed. So that's your brown rice, quinoa, whole grain, whole wheat pastas, your oats, whole wheat breads. So sometimes just making these simple changes can really help with blood sugar management. Foods to really try and limit or avoid. Again, you don't have to not have them at all, but really just decrease the amount and try to um, over time cut back on these foods. So, diabetes has an increased risk of heart disease and stroke. It increases your risk of developing atherosclerosis or clogging or hardening of the arteries. So, these kind of foods increase that risk as well. So, saturated fats, trans fats, cholesterol, and sodium as well. So, a low salt diet can really help. It helps with blood pressure control and also with just cardiovascular risk lowering. Um, so trying to avoid processed foods, trans fat foods, your margarines, your saturated fats, high fat dairy products, animal proteins, of course. Those would be things to think about. Now, exercise plays a very big role in diabetes, of course, and just health in general, but exercise reduces your cardiovascular, your heart risk, and mortality. So it reduces the risk of death as well. It supports weight management, it enhances your blood sugar control. When you're exercising, you have more tissue sensitivity to the insulin that you have, and so your insulin resistance decreases when you're exercising. So the insulin that you have is more effective and it helps bring the blood sugars down. Depends on the type of exercise too, though. And physical activity, when you're using those muscles, it helps those muscles take in the blood sugar that's in the bloodstream and use it as a storage blood sugar. Um, Glucose uptake in muscles occurs through two different pathways. So when we're resting or after a meal, the glucose relies on the insulin dependent pathway, which we talked about yesterday, where insulin binds to the insulin receptor. It opens the glucose transporter and allows glucose to enter the cell from the bloodstream. When you're exercising, it actually activates a non-insulin dependent pathway as well. And so that when you're exercising, the glucose goes into the muscles as well more effectively. Um, So when you're exercising, it's not like, okay, exercise for 5 minutes. It depends on how intense your exercise is and how long you're doing the exercise for as well. So initially, when you're exercising, glycogen, which is your storage form of glucose, is um, is released and kind of it serves as your primary energy source for the muscles so that your storage glucose is used up. But as you continue to exercise and those stores get used up, then the muscles start absorbing the blood sugar from the bloodstream as well as the free fatty acids from fat tissue. So that really helps break down, and that's where you really achieve more of that like weight loss when you have a longer duration of exercise. Aerobic exercise and resistant exercises, like strength training exercises, both increase the number of glucose transporter proteins that are on a cell. And so that helps also more glucose enter the cell, even if there is some insulin resistance. So the recommendations, and this is coming from the American Diabetic Association, and it's in general, but this is kind of the school of thought is that in general, 30 to 60 minutes of moderate intensity aerobic exercise daily is recommended. That's for diabetics and also just for honestly everyone in general, that's the recommendation. At least and then resistance training as well, at least twice per week. So aerobic exercise is where you're typically like continuous rhythmic movement that engages the large muscle groups. So jogging, cycling, dancing, swimming, Zumba, all of those count as aerobic exercises. The recommendations are at least 30 minutes of activity, aerobic activity a day, at least 3 to 7 days per week. So 150 minutes weekly is what's typically recommended. And then resistance training, or it's strength training exercises that help build up muscle mass, muscle strength, and more. That's more a little more like high intensity, but weightlifting, bodybuilding, resistance bands, even that's recommended at least twice a week and focusing on the major muscle groups, so core, upper body, lower body. That's recommended for diabetics to help with blood sugar management. So next I'm going to talk about medications. There are a lot of medications for diabetes. I'm not even going to talk about all of them. I'll cover the ones that I see prescribed more commonly and that most people are put on. But there's always new medications coming out. I mean, it's a big money-making market as well, right? So there's lots of medication options for diabetes. Metformin is typically the first line oral medication for diabetes type 2. And how metformin works is that it improves the insulin sensitivity, so it decreases the insulin resistance, and it lowers the production of glucose. So it increases how effectively the muscles take in glucose, and it also decreases the liver's production of glucose. It does have some side effects. The most common side effects are GI related, so nausea, diarrhea. Sometimes you can have some acid buildup in the bloodstream as well, and sometimes that can be pretty dangerous. But this is the one I see most commonly prescribed for type 2 diabetes. Another oral medication, sulfonylurea. So these medications, they increase insulin release from the pancreas. So they take your natural insulin production and kind of increase that. And this is kind of a diagram. I don't know if you can make it out that well, but a sulfonylurea attaches to the sulfonylurea receptor. It causes this channel to close on the cell, and then it decreases the potassium leaving the cell. It helps with calcium going into the cell, and when calcium goes into the cell, insulin gets released. So it increases that insulin release in the pancreas. Um, Side effects of these medications, so weight gain is pretty common, and then these medications specifically can cause hypoglycemia or episodes of low blood sugar, which also, like we talked about yesterday, can be, if it's dangerously low, that can be life-threatening and cause a seizure and even death. There's DPP-4 inhibitors. They also help with insulin release, and they decrease the production, the release of glucagon, which is the storage blood sugar, and they decrease liver's production of sugar as well. They can cause pancreatitis and some like hypersensitive allergic type reactions as well. Another oral medication class, these SGLT2 inhibitors. These medications essentially help you pee out sugar. So they increase the excretion of glucose in the urine. Um, Side effects of this would be, if you have more sugar in the urine, increased risk of a fungal infection, urinary tract infection, and because it makes people urinate more, it can affect the blood pressure as well and cause a large drop in the blood pressure, especially when someone stands up. It can cause the blood pressure to drop and cause syncope or episodes of passing out. And then injectable. So those were four examples of oral medications. There are also injectable medications to manage type 2 diabetes. The non-insulin medication that has gained a lot of popularity in the last couple of years are the GLP-1 receptor agonists. So these are your Ozempic, Wegovy, Mounjaro, Trulicity. They improve your body's release of insulin and they also reduce your appetite. So it slows the emptying of the stomach. So if you're eating, it makes you feel full more quickly. And as an adverse effect, it can cause nausea, vomiting, decreased appetite, which is kind of the intended side effect. These medications are designed to make you want to eat less. Um, and then also linked to thyroid cancer as well and pancreatitis. And then another injectable medication, of course, is insulin. So depending on how severe the type 2 diabetes is or how insulin resistant someone is or if they have complications, I mean, usually insulin is mainstream for or mainstay of treatment for type 1 diabetics, but for type 2 diabetics, usually if I have someone with a hemoglobin A1C of above 9 or definitely above 10, then we're talking about starting insulin. Because most of the oral medications and the GLP-1s even, they may reduce the A1C by 1 or 1.5%, but the insulin is really where you're going to see the most reduction of the A1C. And so insulin, just to go over, there's a couple of different types of insulin. So insulin, of course, is naturally made by the pancreas, um, and it moves blood sugar from the bloodstream into the cells all over the body via that insulin receptor. There's short acting, long acting, intermediate acting. As in it's a common side effect is that it will, of course, lower the blood sugar because it's intentionally lowering the blood sugar, but sometimes if you take too much or you take a dose of insulin, but then you don't eat enough, that can cause some low blood sugar. And then just some skin reactions to at the injection site. That's all I got. Questions?
Excellent, Riddhi.
Thank you.
What class would be globulide?
That's a sulfonylurea.
Okay.
Yeah, so that's the
Is
one.
the glyburide same as globulide? Is that
There's glyburide and glipizide. Those are two sulfonylureas. Those are the ones that cause your body to release more insulin, and they have an increased risk of causing low blood sugar.
okay? But there's nothing like globuride.
There's glyburide and glipizide are the two sulfonylureas that spell it for me. Is the one that you're thinking?
Globuride.
No.
No, it must be
There's the GLY, yeah.
Yeah, my wife was diabetic and I used to pick up her medicine and she used to just metformin and globuride. But I bet, I think it might be glyburide.
Yeah.
Yeah, it's
Probably.
just pronunciation. Okay.
Yeah.
Thank you so much. I had a quick question too. So I know diabetes is a process, but the sooner we get diagnosed, the better we can get help. But like, does it start, the symptoms start like how many years in advance?
Yeah, it depends. I mean, some patients don't have any symptoms for years. So because it can affect, it can affect a lot of small things that you may not realize. So the most common symptoms, especially if your sugars are very, very high, or especially type 1 diabetes is usually diagnosed if you have increased thirst, increased urination, and weight loss. That's like classic type 1 diabetes. And then usually when they're diagnosed, their sugars are in the several hundreds. Type 2 diabetes is a lot slower process. Some people can have a blood sugar of 200 and not have any symptoms for years. Um, but typically, when your blood sugar is above 180, that's when it spills over into the urine. And so the most common symptom is still just is increased urination and increased thirst. So there's the most, I guess, the earliest indicator, but some people can have some numbness, tingling, slowly developing over years and not really realize it for, several years sometimes. It's kind of like, kind of like high blood pressure in that it can affect every organ in your body. And sometimes it's picked up because, oh, you got an infection and then someone tested you and they realized, okay, you have this condition. But I see, not here so much, but in the training in the past, I'd have patients who didn't see a doctor for 5 or 10 years, and they've been living with diabetes for that long and just didn't know or didn't have access to care to get it treated or diagnosed.
So can people get it over the age of 75 or 80? Like, what is the average?
Yeah, absolutely. It's more common, I'd say, between like 25, like 20, 30, almost 30 to 75 is the more common, like even younger than that, I'd say like middle age, we see it a lot. But you can get it as you're older too, especially going from pre-diabetes to diabetes, depending on, if there's any weight gain or dietary changes or increased stressors, you can certainly develop it at any age. Even in children, you can have type 2 diabetes. We're seeing more and more with obese children or children who have metabolic disease or fat, what we call like fatty liver or um, more prone to having these metabolic syndromes. And genetics plays a big role as well. So it is hereditary too.
I know people watch their sugars, like they give up sugars, but even the carbohydrates impact
Yeah.
impact.
Yeah, absolutely. And some people can eat sugar their whole life and not have any problems. So it's a lot of it is diet, but a lot of it is that insulin resistance, your weight, exercise, what you're eating, so complex versus the simple carbs, what kind of sugars. But a lot of it is your lifestyle as well in general, not just what you eat. So the weight, especially, more central obesity, like more belly fat, higher risk as well.
Riddhi, why do you think it's so common in Gujaratis or Indians? It
There's
seems
all the
like
gotcha.
every. I'm just saying.
Gotcha.
No, it's a lot of it is genetics. Like we see it, more commonly in Native Americans, Asians, definitely Gujaratis, African Americans, Hispanics more than Caucasians, and definitely the more fried food, more fatty food, is higher risk. I think our Gujarati diet is overall pretty healthy. I mean, it's a lot of fruits and vegetables,
Yes,
but
agree. Mhm.
the it's we still have a decent amount of, fried and foods that are high in fat or higher in cholesterol. Because a lot of Gujaratis have very high cholesterol too, right? With a lot of, especially with the dairy. I'm not going to blame the ghee because I get in trouble for blaming ghee, but it's a lot of what we eat too.
Yes, keys.
And exercise is not necessarily like part of our normal upbringing or routine, right? The
Mm.
kind of the idea that we should exercise 3 to 5 times a week or 150 minutes. every week. It's not something that at least I've grown up with.
And, and nobody does yoga, they should. Nobody does those basic things that's part of our culture. Forget the Western culture. We had it in our culture, but nobody does it.
Yeah.
Mm.
I mean, stress is a huge, huge, huge factor. So, the increased stress level, increased cortisol level, you eat worse when you're stressed. So, definitely doing things like yoga, meditation, uh, will help with blood sugar management. It's just people, it's hard to take the time out or know how to do it properly. And so that's why this course is, of course, very, very important.
Do you have anything for like alternative medicines? Like I know a lot of people take like faki and methi na dana and
Yeah,
like karela now, stuff like that. Does that really help?
so the unfortunate thing is a lot of those haven't really been studied that well. And I think part of it is the studies that are done typically by pharmaceutical companies or companies that are interested in getting their drug on the market. So they're not going to study these more alternative medications or herbal remedies. But I've heard from patients that things like cinnamon, apple cider vinegar, there are certain more herbal things and more natural spices that help with blood sugar, especially like apple cider vinegar. I've heard from endocrinologists, having that before bedtime can help with your fasting blood sugar in the morning. So there are definitely a lot of things that we don't know about, I think, and it's unfortunate because they probably will not get studied because to study them is not it's not going to make anyone money.
Yeah, I found this article. I was just going, accidentally found it, but it says ginger. It was on ginger. And it says there are pharmacological studies done on ginger. And it says it can lower blood sugar level
Hmm.
along with some other benefits. But
Yeah.
but it does recommend that it should not be taken by severely by diabetic people because it can lower and complicate issues if they're taking medication.
Yeah, so it really, a lot of them can lower, but it depends on the degree of how much it lowers to make it effective. Um,
Mhm.
so, medications are studied, okay, it lowers, like metformin may lower your A1C by 0.5 or even 1%. Um, but I think the data is still not fully there on a lot of the herb, but like even I think like turmeric too, right? Turmeric can help just decrease your body's inflammatory state, and so that can help with so many health conditions, but that can help with diabetes as well. Definitely ginger too. I think a lot of our Indian herbs and spices,
Right. In
um,
general, are good for our gut.
yeah,
And yeah,
and gut health is everything.
right.
Yeah, but the important thing to maybe emphasize is that it's like blood pressure. You've got to be on top of it all the time. The problem with blood pressure is if you have half a day you control it, another half day you don't, it still will end up causing disease. And so even when you have diabetes, while you can try dietary person, of course you should do all that, but the control has to be solid. It cannot be up and down because you still end up damaging your nerves and your vessels. So
Hmm.
I think it's one of the biggest problems is that which one gives that steady control, like blood pressure. And you can try all sorts of things, but you can't get the steady control without the help of medication if your blood pressure is significantly high. You can help by yoga, you can help with diet, maybe 10% here, 10% there, but it won't be consistent. Of course, you could be an extreme yogi and it might, but for most of us, it won't be enough to keep it controlled all the time, and that's kind of the catch. So all those things are additive and helpful, but you can't assume that's going to keep it controlled all the time to avoid the diseases that Riddhi mentioned, which are the chronic conditions. That's the catch. It's why you need to be combined with these therapies because the stability and control they give you, you cannot get. Now you can maybe lower it and you can maybe avoid it by in pre-diabetes, but to actually assume that'll control your diabetes is too far-fetched. They're not that effective. As
So
you see tomorrow,
gestational, oh, sorry.
no, as you see tomorrow, the effect they have is measured, and it's not going to beat that goal you have. It's going to help to add up to your goal. As you see, in the best studies show the benefit, but there's still it's only that 0.5 what there was mentioned in the A1C, which is very helpful, but not quite the goal you want to get to. So it's a helping hand, good helping hand, I would say. Sorry, go ahead, Shital.
Oh, sorry, I just had a quick question. I was diagnosed with gestational diabetes with my second one. And then, it went away, but lately I've understood like it can come back, right? That's just
Yeah.
like,
Yeah, so gestational diabetes can increase your risk of developing diabetes later in life. So it's whether it's, couple years out or decades out, it still carries a higher risk of developing diabetes later in life, the gestational diabetes. Yeah.
because I snack on little things. Like I need food every few hours, and I don't know if that's a good thing or a bad thing, but and my kids say, Mom. So
Yeah. It's hard. I I have patients who even if they're diabetic or not diabetic, right? They say, oh, someone told me never to eat this or that, and I tell we all have our vices at the end of the day, and it's just about trying to make small changes to start off with small changes because I think even as a non-diabetic, like I know when I have something that's high in sugar, I have candy or a sugary drink, like I'll feel great for maybe 5, 10 minutes, and then after that, maybe in a half an hour I'll feel the crash. And I think most of us have felt that, post sugar crash. It's not good. I mean, it's not good for any of our bodies, and I still do it. But trying to at least be more conscious. I mean, I would love, putting a blood sugar monitor on any of us. I think that would be helpful to see in real time. Hey, this is what I did, and I ate this, and my blood sugar did this. Um, I think that data would be really cool, even as a non-diabetic, to just see how your blood sugar is throughout the day, because I'm sure, it fluctuates a lot, and like Mama was saying, like you may feel fine, for, your sugar may be okay for parts of the time, and you eat something or you're stressed and your sugar goes up, and um, to know that, okay, my sugar is this way and I feel this way, that there's a correlation that could help us all make healthier choices. But even, I mean, snacking is hard. A lot of us snack, and I think just choosing healthier snacks, easier said than done. I mean, Vijay tells me all the time to not have candy and eat nuts, and I don't listen to him, but someday I will if he nags me enough. But yeah, so I think just trying to slowly make healthier choices, knowing that we're none of us are perfect, but we can try.
In this course, we're not really covering maybe we should diet as well, of course, in this way or whatnot. But I had a question. IMBIL, we don't have the VIG-A, which is obviously. So you think that IMBIL, and you know what there's really, I think, should protect us at least during that week from IMBIL already from high sugar. I mean, I think that diet, the IMBIL diet must be pretty good, right? Have a break once in a while in your body to kind of not have high sugars might help once, twice a year.
Yeah. I mean, I think there's still the carbs, but definitely, yeah, the no salt, no sugar diet is, I think it's a hard one to stick to, but definitely, I mean, I think finding something that is sustainable, like even, a lot of people are on these weight loss medications and lose a ton of weight and their A1C goes down, and but a lot of them, as soon as they stop the medication, their weight's back up, or so I think making smaller choices that are more sustainable, even, intermittent fasting is great, but if that's something you can do forever, great, but I think that it's hard, because we all, have these tendencies to want to um, uh, make poor food choices, and it's all self-control is very hard. So I think trying to make healthy choices that are maybe not huge, but day to day can help a bit more than making a huge change that is really something that you're not going to be able to stick to in a couple of weeks or months. To me, that's more valuable.
It's always the slow and steady that wins the race, right? You're absolutely right. If we try to crash courses, it won't work. Good point.
Riddhi, is type 2 diabetes reversible?
It is to a certain extent. So, if treated early, whether it's with lifestyle changes or weight loss or exercise, or even with medications, like you can start metformin, doesn't mean you have to be on metformin forever. But it is reversible, especially with weight loss and dietary and exercise changes. To like if I've had patients whose A1C was as high as 9 or 10 and when they were first diagnosed with type 2 diabetes, and they've made drastic changes and they are able to reverse it to a certain degree. So, they may never get to truly not be diabetic anymore. Some are. So a lot of it is genetics as well, but some get down to an A1C that's not in the pre-diabetic range anymore, or they may be down to a 7 or a 6. So, um, it's just, but the biggest thing is making those consistent changes and then just following up with a doctor regularly to say, hey, because it doesn't, a lot of times patients will think, okay, I'm going to the doctor, they're going to prescribe me something because I have this or that. But I think finding a doctor that kind of works with what your goals are and say, hey, I know I have this, give me 3 to 6 months, let me try to make these changes, let's reevaluate. And then if my levels are still high, then maybe we can start something. So having that kind of consistent and recurring kind of checkup will help as well. But it is reversible. Type 2 diabetes is reversible. Now, over time, as the pancreas has worked harder and harder, it can get burnt out, and so you can develop almost a type 1 kind of picture in type 2 diabetes where you need insulin. And at that point, usually it's not that it's not reversible still, but it is much harder to reverse at that point.
Mhm.
Riddhi, I have a question for the type 1 diabetes, for especially for the kids, newborn who are born with it. So just the insulin, nothing else could be done for those.
Yeah. Unfortunately. Yeah, that's the only treatment. When they're older, potentially pancreas transplant and all of that. But even that, it's not really that commonly done. I think if a kid is being well managed with an insulin regimen, then the preference is to just keep them on that insulin regimen versus a pancreas transplant down the line. But before insulin was invented, any type 1 diabetics would just die. There's no cure. Yeah, it was just insulin. So it wasn't
Okay.
until insulin was utilized as a medication that it was finally treatable.
Okay.
Yeah, it's hard. I mean, there are some kids who are diagnosed at a very, very young age and they have to do the injections and check their blood sugars. It is a very, very
Mm-hmm.
difficult disease for the kid and for the parents. And
Mm-hmm.
um,
Yeah.
yeah. Any other questions?
Thank you, Riddhi. Nice.
Thanks, Dad. All right.
Bit biased, bit biased. No, it's very good though. It's really good. It's good to have
Yeah.
discussion like this and leave time for discussion because that's often where we get more out of, it's very helpful to have this much discussion time. So I think people appreciate that.
Yeah, no, I appreciate it as well.
I had one last question, sorry, before I
Yeah.
go. They have these sugar, alternative sugar packets like stevia and all that thing. Do those really help you a lot, or like people who are non-diabetic but they still choose to eat that?
Yeah. So those may help in terms of like lowering your calorie intake and lowering your glucose intake, but they still they're still not great. They still have other other sugars in them that are still not good. Like they're better and depending on the supplement they're better but they still have overall they have lower calories so they may be a little bit better but it's still not a great substitute.
So people who don't have diabetes, but they choose to not eat any sugar, but they choose the sugar substitute, is that needed for them or not needed?
What do you say? I'm gonna phone a friend, ask Vijay. The sugar substitutes, like your stevia and your um, but like people who do not have diabetes, should they do these sugar substitutes or kind of stick to the more natural sugars?
More natural sugars with fiber would probably be better in general.
More natural sugars with fiber. And fiber is really important because it helps slow down the absorption of sugars.
Means fruits and vegetables. I mean, fruits that
Yeah.
have sweet.
Those people who have diabetes due because of the heredity, is there any solution for that?
I mean, solution-wise, just management options. So you can, because of hereditary, you may have pre-diabetes or diabetes, but as long as you're trying to control it, whether, it's diet, exercise, lifestyle, or medications, some of those, some people will unfortunately do everything right and they just have bad genes. And so they may still need medications, but so the treatment really would be medications plus all the other like lifestyle, dietary, healthy food choices. Um, but sometimes, I mean, that's true for, even high blood pressure. Sometimes you can have a great diet, low salt, and your blood pressure is still high no matter what you do because of the genes that you inherit. Same thing with heart disease as well. So there's a lot of, diet, lifestyle changes that you could try to make, but ultimately sometimes our genes are what we inherit.
There is no solution to change the genes.
Not yet, not yet. Not that I know of.
Yeah, our Dr. Devendra is trying to change the genes.
There are gene therapies out there, not for diabetes as far as I know, but there
It'll
are.
happen, but not in our time. It'll definitely happen, but
Yeah.
not in our
Yeah.
time. Yeah.
Yeah. And there's
What
constantly,
what is more what we say harmful? It is diabetes type 1 or 2?
so both, type 1 is more type I would say type 1 is more dangerous in that like without insulin you can die. Um, because your body needs insulin to take the blood sugars into your bloodstream. Like there is no insulin in your body without injecting insulin. But type 2 diabetes, if it's not controlled, can be equally as harmful. So I've seen patients with, type 1 diabetes who, uh, 30 years old, did not take their insulin or didn't control their sugars, and they end up with uh, toe amputations or below the knee amputations, or they're blind or they're on dialysis. I mean, it can have a lot of complications, and the complications can arise from just not managing it for even 3 to 6 months. It doesn't take a long time for poor blood sugar control and type 1 diabetes for you to have pretty severe uh, end organ damage. Versus type 2, in most, depend if as long as it's not severe where you're now kind of almost like a type 1, type 2, your body is still making some insulin. So it really takes much longer for a type 2 diabetic, if it's uncontrolled, to have those have more complications.
This diabetes is due to our modern lifestyle more or any other reason?
So type 1 diabetes is autoimmune. So that's, your body is attacking itself essentially. Sometimes it can be genetic, so it's hereditary. It can also be sometimes like post-viral infection. We don't really know exactly what causes it.
Mm.
it's linked, when you have one autoimmune disease, you have a higher risk of having other autoimmune diseases. So it's linked to like higher risk of thyroid issues and celiac disease even, so other autoimmune conditions. But I wouldn't say it's due to our modern, like type 1, especially not due to, our modern lifestyle. I'd say it's been around for forever. Um, and that's more, there are certain maybe newer viruses that have been linked to increasing risk of type 1 diabetes, but it's type 2 diabetes definitely. I mean, the more like the less exercise, more weight gain. Our diet has changed a lot as well, the fast foods and fried foods, and just the not moving around as much, like especially the like we're a lot more like work from home population now as well. So that decreased activity does increase your risk of type 2 diabetics. So it's projected to increase more and more over the next several decades in terms of like right now, I think it's like 1 in 10 between the ages of 30 to 75 globally are estimated to have type 2 diabetes, and that number is projected to increase over the next several decades.
Do you think that these diabetes and such other diseases, they are in modern times and not in the ancient time?
I think more and more in the modern times, especially type 2 diabetes, versus less so, our diet has changed a lot. So we're eating more processed foods that are higher in fat, more sugary foods, cane sugar and like the high fructose corn syrup. That is a fairly modern, I would say, issue compared to, 100, 200 years ago, or even earlier than that. Those, it was more like healthier foods. So, and with people, in general, more active as well.
Yes.
It's described, I remember someone's described like in our ancient literature, they call it honey urine. It's been described even in Indian like more than 3,000-4,000 ago, and then in Greeks. But I think it's not new. I don't, the amount maybe obviously is really mentioned exactly that. But I think it's been around always. Even at that time, even Hippocrates' time, they had obesity. Surprising. But the wealthy landlords also had weight issues, even not the same level now. So I think disease is all the same factors. So, so we've had it forever, so it's not new.
Yeah, because there in ancient time there were 16 types of big, what you can say, harmful diseases which have been recognized. Among them, well, I think there is no such mention of sugar problem. So just I wanted to know. It is because of our modern lifestyle, it was not so much in the previous time. Okay, so thank you very much, Riddhi, for giving wonderful talks on, especially on diabetes. And this time in this second lecture, you have shown that how exercise can play a crucial role in decreasing the blood sugar. So that is very important for us to know. And yes, there are several other exercises which have been shown in the yoga texts that this can be done to decrease the blood sugar. And we are trying to practice those things.
Cortisol levels also.
Cortisol levels also. So most of the diseases are caused mainly because of the cortisol level or stress, no? So we are giving more emphasis on relaxation. You have to relax yourself. Even after 1 hour hard work, you have to relax for 2 to 5 minutes and regain again the energy and make your mind more relaxed. So that you can work peacefully and without any stress.
Okay. Thank
Yes.
you, Vandami. and
Thank you,
Samson.
Riddhi.
Thank you, guys. Thank you for joining.
You
Thank
Riddhi.
you.
Thank you, Riddhi.
Bye.
Thanks. Great.
Okay, so now Anita is ready to give the
Namaste.
session. Yes.
Yes, Samiri. So today we'll do a perception of breathing. So let's begin. Sit in a comfortable position, standing, sitting, Sukhasan, half lotus, full lotus, uh, Gyan Mudra, and we'll start with 5 Om sounds. Om. 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 Relax your body. Make sure your back, neck, and spine is straight. Resolution for the meditation. I'm practicing Priksha meditation for the purification of my psyche. I'm practicing Priksha meditation for the purification of my psyche. I'm practicing Priksha meditation for the purification of my psyche. We'll start with relaxation. Make sure your breathing is deep and slow. And you are fully aware. Concentrate on your mind on the big toe of your right leg. And spread it around the entire big toe and provide auto suggestion to relax. Your big toe is relaxing. Move to the remaining toes of your right foot. The rest of the toes are relaxing. Now we'll Slowly move our attention from toes to the hip joint, relaxing our heel, ankle, calf muscles, knee, thighs, up to the hip joint. Our entire right leg is completely relaxed. In a similar way, we relax our left leg from the toes to the sole, heel, ankle, calf muscles, knee, thigh, up to the hip joint. Our left leg is completely relaxed. Moving to the mid part of the body, relaxing the abdomen muscles, intestine. We'll focus on our rib cage, front, sides, back. Each and every rib is relaxing. Our lungs, chest, heart, and the collarbone. The backside of our spine. The middle portion is completely relaxed. Now we'll relax our hands, starting from the right thumb, fingers, palm, wrist, lower arm, elbow, upper arm, up to the shoulder. Right hand is completely relaxed. Moving to the left hand, relaxing the fingers, palm, wrist, lower arm, elbow, upper arm, up to the shoulder. The left hand is completely relaxed. The mid portion of our body is completely relaxed. Now relax the neck muscles, throat, vocal cord, chin, facial muscles, jaws, palate, tongue, nose, ears, eyes, forehead, brain, our entire body is completely relaxed. Just move your mind one more time from bottom to top and top to bottom. Your body is completely relaxed now. Now we'll move to our next phase, perception of breathing. We'll focus on our breath. When you breathe in, your stomach muscles are expanding. Your diaphragm is going down, expanding the chest area. Your collarbones are going a bit up. When you breathe out, your stomach muscles are contracting. Make sure every breath is easy and not forced. Focus your attention on your navel area and perceive the expansion and contraction of your stomach. Be fully aware if there are any thoughts. Do not judge Just let them pass. Focus back on your breath. Perceive the vibrations on your navel area. Every breath is slow, deep, without any force. Now we'll bring your attention to our nose at the junction of both the nostril and observe each and every breath coming inside our body and going out of our body. Perceive each and every breath, temperature, the amount of oxygen getting to each and every cell, and the carbon dioxide released through the nostrils. If there are any thoughts, you can also practice holding your breath if your body allows it. With each breath, the oxygen is providing the vital energy to each and every cell. Be aware Continue a few more deep rhythmic breaths. Now with 2 Om sounds, we'll close our practice. Om. Om. I will rub both the palms and put it on our eyes. And blink our eyes to get the energy.
Thank you, Anita.
Amen. Sami.
Yes. So hope the main instructions are being followed. Is it?
That was very good, Samniji.
Yes. So
Was everything, Samiji? I think I couldn't. That was very good, and your steady voice is quite powerful.
Was it too fast during the relaxation? Because I was thinking like I want to finish it in 5 minutes, but I might be a little fast.
yes. So yeah, we have to see the time. According to that, we have to divide that time for each step. If we have just 15 minutes, then 5 minutes in relaxation, 10 minutes in breathing perception.
Okay.
Yes. Okay, so thank you very much.
Thank you.
Thank you,
Vandami
Anita.
Namasamasham. Thank you so much.
Namaste, Samiji.
Who's doing it tomorrow, Samiji?
What you have said?
Who's be doing it tomorrow? The
Tomorrow.
meditation after my talk. I'm going to give a talk, I think, on research, but after that.
Okay, so who is ready to give? I have said for 3 days.
I can continue.
Yes.
Okay.
Okay, done.
Okay. Well, nice, Samiji. Yeah, thank you. Just
Thank
clarifying.
you. Vandami Namasamasham.
Vandami
Namaste,
Namaste.
Samniji.
Yes.
Rakesh,
Ji,
how did your friends like the camp?
very, very much. They
Oh,
really
good.
enjoyed it. They had a lot of compliments, and they felt relaxed, and learned a lot about karma. They were full of compliments and how well they liked it, and they want to attend it every year.
Oh, brilliant.
Yeah.
I think we had 260, I think, on the day. Apparently, the numbers
Yeah,
was
260 people.
Was
huge.
staggering.
Yes. No, everything
Huge.
went perfectly. The food, the living arrangements, the sessions were on time, and one after the other, they commented that, every session was a step above the previous one. So the expectations were never, they were exceeded with every session. So,
Yeah, it's a wonderful
yeah.
weekend, but no, we were surprised at number. We were all, obviously
Yeah.
concerned about managing that volume, but the ladies did so good in the kitchen, the serving, and
Yes.
that was
Yes.
Good voluntary work.
Yeah.
they wouldn't give it to us. We tried to take over the lunch on Saturday. Said, no, you'll mess it
No.
up. They kicked us out.
No,
I'm so glad. I'm glad they did.
It went
They did a
very
good job.
smoothly with 260 people. Even with 260 people, there was no major delays. Then everything
No,
flowed
was-
very, very well.
it's
Everywhere.
astounding.
Smooth process. It was been very smooth process.
Well organized and thought out.
It's astounding, and the
This
time
was the
between
best
the talks was.
camp we had
Yeah.
so far.
Yeah, I thought it was a good mix, and they enjoyed the session with the youth.
Mm.
What was that? The panel discussion
Mm.
with the youth, that was really enjoyed, and of course the drama added,
Yes, yes.
to their
It
experience.
was the icing on the cake.
Mhm. Yeah, icing on the cake. Perfect. Yeah, exactly. And there was a request yesterday. I'm attending the 7 to 8 session with Samnihim Pragyaji.
Mm-hmm.
She's doing the Upsarg Strotra,
Oh, yes.
continuing
Yes.
every day now. And there was a request yesterday to repeat all the karma sessions with the Samanizis. So today, from 8 to 9, which is a conflict for me with this course, but today, the Houston Samaniji, Arjo Pragyaji, talked about Vednya Karma. And I requested them to record. So that
good.
I forward that to my friends over here.
Oh, good. Yeah, do that. And maybe forward it to me too.
Yeah.
But yeah, that's great.
I think they will put it on the site, but since they're not part of the...
It would be nice.
They're not part of the...
Yeah, no, I'm joking. Yeah, but yeah, you have to give it to them. That's really good.
Yeah.
I feel what you did taught me a lesson to get your even non-Jain friends to come, because for them it's progress in the journey, right? So it's not like we're trying to convert them. And I feel we could probably do that more. I don't know that I really reach out to non-Jain friends. I don't necessarily do that.
They really appreciate it, and there is no qualms about Jain and non-Jain.
Correct.
They were very, very open to it, the whole idea, and they knew, of course they have to know what to expect. They would bring anybody, any unknown.
No. That would not work.
Expose them to Jainism talks, but these people knew, and one of them, then this was her third camp. She had come with Indu twice before.
Oh, cool. So she kind of had expectations.
Yes, this was the third time.
Brilliant.
Yeah. Yeah, her husband, it was first time for him, and the other couple, it was first time for them, but they have been exposed to Jain concepts and through their circle, and they knew what, this is a Jain focused camp, so it was not an issue. Devendra bhai, we carpooled all three families.
Oh, nice.
So the person whose car driving, they received a text with the number plate and saying that you have to pay for parking.
No. Just what you have to say is say to the hotel that, I realized that I didn't give my number in when I checked in, but I did stay there just said, and they would waive it.
I'll call them tomorrow.
Yeah, I think you'll have to come directly from him, but if any problem, let me know. We'll talk to the owner. But basically, even I forgot, and I had a ticket on my window the last
Yeah,
day.
same thing.
I went and gave it to them. They says, okay, you
Okay.
know,
Okay, that's
you
what
just they just have to have a number and you state there any evidence, and they
Yeah.
will not.
Okay,
They'll
that's
not. But
what
any
I
problems,
thought.
then let me know. We'll
Yeah,
talk to
because
the owner.
they're so close to the airport, and some people may take advantage of, parking
Yes,
there and flying out.
yes.
So
Yes, some shit's happening all the time. It's legitimate. And when we went, they told us to give the number plate. We forgot. So it's always my fault. Like it was when I acted there, they said number plate. When I said, "Can I park?" He said, "Yes, but I need your number
they
plate." I
did
forgot.
but I just forgot.
And I forgot totally. So I just say, but they were okay. So I think if you call them, say I stayed there and this is my number, I probably forgot to give you the number plate, then they'll be okay.
I'll do that.
Yeah. Yeah, sorry about that, but that should be okay. Did you get back to the center at 3 o'clock, 3, 4? You said
Yes,
you'd try and get
we
back to the
did,
center.
and we had a good interactive session over there also with Samniji. Samniji was back.
Yeah. Good. I'm glad it's
Oh, I think they whenever I signed off.